As you say, some slightly more upbeat messages about the Prime Minister's health emerging, and at the weekly press conference in Downing Street, a nod towards perhaps some sort of turning point. The Deputy Chief Scientific Officer saying that admissions to critical care, although still sort of alarming, were stabilising potentially, and that might suggest that the spread of COVID-19 was not accelerating. But at that press conference, I asked the Chancellor on the economic side, could we be seeing well over 3 million unemployed in this country? And he said, I don't deny there is hardship ahead. On the lockdown, as you said, it's quite clear that the review after 3 weeks, which Boris Johnson promised of the lockdown, is going to happen and is going to resolve to maintain it. You're just beginning to pick up interesting nuggets of conversations, though, that are going on inside Whitehall about how exit might work and the first sort of delicate steps that might happen at the beginning of an exit strategy. Things like maybe nursery schools might open, maybe even primary schools, shops, if they can enforce distancing, might be allowed to open. Effectively, the first phase of an exit strategy, when we get there, not imminently, weeks away, would feel a bit like the week before the full shutdown happens. So a long way from freedom, and we are a very long way from the big exit itself, as Boris Johnson faces his third night in an intensive care unit. Downing Street relayed a message from the medical team at St Thomas's Hospital saying the Prime Minister was still in intensive care, responding to treatment and in a stable condition. Only clinically relevant information would be released, journalists were told, and the Chancellor at the daily press conference went a bit beyond that.
The latest from the hospital is that the Prime Minister remains in intensive care, where his condition is improving. I can also tell you that he has been sitting up in bed and engaging positively with the clinical team.
Dominic Raab was still deputising for the Prime Minister today, but one who stood in as deputy for an absent PM himself acknowledged that doesn't mean you have licence to make big judgment calls.
From your experience of when you had to deputise, normally when Theresa May was on holiday, if there's a really big call to be made, does it tend to be sort of shoved down the pipe and delayed until the Prime Minister is back on duty?
Well, it doesn't so much get shoved down the pipe. And as ever, one of the advantages of the flexibility of the British Constitution is that it does allow for common sense. You know, if there's a decision that has to be taken in the next 20 minutes, then you have to take it. But those decisions at the top of government are extremely rare.
But there's no guarantee the Prime Minister will be back in the saddle anytime soon, even if he continues, as Number 10 says he has so far, to avoid the debilitating use of a ventilator.
What's the sort of range of expectations people should have, and should they not have their expectations he's back at his desk anytime soon?
Generally, those that come to intensive care and avoid organ support may not need very much time off. It varies with the individuals, but they would be given the same advice as any patient that's come into hospital with an illness, that obviously they will need some time off and they may need some help. Don't rush back. If you do rush back, the problem is that you might find things are much harder than you thought.
The Welsh Assembly, meeting by video conference, heard that the lockdown, which Boris Johnson promised would be reviewed next week, would continue.
The 3 weeks of stay-at-home restrictions provided for in the legislation, and which we have all faced, are due to end next week. I must be plain with all members. These restrictions will not end then.
They jumped ahead of any Westminster announcement. Sources said that was triggered by concern that people on Easter break might flood Welsh beauty spots.
We committed that there would be a review in and around 3 weeks. That review will be based on the evidence and the data provided by SAGE, which will only be available next week.
Responding to pleas from charities worried they faced a £4 billion shortfall because of the economic shutdown, the Chancellor announced help for the sector.
Those charities have never been more needed than they are now, and they've never faced such a sudden fall in their funding. So today I'm announcing £750 million of funding for the charity sector.
The wider damage of the economic hit here is being mirrored across Europe. Forecasts suggest France and Germany are now in recession. Other statistics point to ominous unemployment levels not seen since the 1930s. Unemployment figures from one European country so far post-COVID crisis, Norway, unemployment well over 10%. From the data you look at in the Treasury, can you hand on heart say we're not going to see something like that here?
No, Gary, I will be absolutely honest. This will have a significant impact on our economy, and not in an abstract way. It will have an impact on people's jobs and their livelihoods. And that's why we've taken the actions that we have. Others and myself have talked about universal credit claims, which have come down from where they were 10 days ago, which is comforting, but they're still very elevated relative to what normal levels might be, sometimes 4 or 5 times higher. That is obviously something we look at.
The Excel Centre in London's Docklands, now a temporary hospital, taking its first patients. This was the setting for a G20 summit after the banking crisis that tried to avert a global economic meltdown. The IMF has warned this crisis is way worse.
And I can tell you we have never seen ever such a growing demand for emergency financing. Already over 90 countries have been placing requests to the IMF for it.
What was critical 10 years ago is that every country, from the Republican-led US to the communist-led China, they were sitting around the table, frankly, because they were scared to bits. Now, we should be scared to bits today, and you do need that cooperation. Unless we deal with this, with the richer countries helping the poorer countries, the developed helping the less developed, then this is going to go on for an awful lot longer, and every single one of us will pay the cost of that.
But so many countries are caught up in their own dramas. The Brighton seafront, lunchtime today, nearly empty. An Easter weekend approaching like no other, with no one knowing when this ends.
Gary Gibbon reporting. Now, agree or disagree, there is no denying President Donald Trump's blunt in his messaging. Today, he accused the World Health Organization of being too China-centric in its handling of the pandemic, saying they really blew it. The WHO countered, saying that working with China was essential, while sending a firm message that easing the Europe-wide lockdown now would be extremely dangerous. That warning came as more people died today in UK hospitals than ever before in this pandemic, and equipment shortages and oxygen supply issues remain very prominent. Here's our chief correspondent, Alex Thompson.
Today it was confirmed that 7 residents at this East London care home have passed away. Another 21 are showing symptoms of the COVID-19 virus. There are 49 people living here, and a dozen staff are off work because of the virus. Overnight and across the day, those at the most hazardous end continue to pay the ultimate price. Last night, news that Alice Ong had died. She had 44 years nursing experience in the NHS. Her family believes she became infected working in a doctor's surgery without protective equipment. This morning, news that Barbara Moore passed away at the Royal Liverpool University Hospital. Aintree University Hospital, where she worked, said she was one of our unsung heroes. Across the UK, overflow ventilation hospitals sprout up in the suburbs. This, Birmingham's NEC today. In London, the first beds being filled in the vast warehouse field hospital set up in a Docklands exhibition centre. Overnight, global pandemic politics got confrontational. Donald Trump calling the World Health Organization biased towards China. And then, the man who said the pandemic would be over by Easter offered this.
We will look at ending funding. Yeah, because you know what? They called it wrong. And if you look back over the years even, they're very much, everything seems to be very biased toward China.
Though the record suggests Trumpian threats to stop paying America's subs to anything from the UN to NATO need to be checked against delivery. The WHO itself popped up this morning for a global news conference addressing not so much White House rhetoric, but the pandemic in Europe.
At a minimum, to keep transmission suppressed, we must prioritize maintaining extensive testing, isolation and contact tracing measures and planning these ahead.
A telling message that to a British cabinet still without the boss and still with NHS supply and overload problems. critical levels of oxygen pressure in major hospitals continue to be an issue. Last weekend, this caused Watford Hospital to divert all patients elsewhere, including emergency cases. This programme has seen evidence of significant problems too at London's Royal Free Hospital. An internal hospital email dated April the 5th tells staff they can't take more than about 70 ICU patients because
the third and fourth floor are also a major use of oxygen and the pressure is now dropping in the system. Therefore, we've been told 70 is safe. Above that will cause issues.
The email also refers to problems in other parts of the hospital.
Oxygen supply to the tower is an issue. We can only have 6 CPAP machines on the go at any one time in the tower, after which pressure drops and it can affect all floors. This is due to the diameter of the oxygen pipe to the tower, as well as the amount of oxygen being consumed.
The Royal Free internal email also states that ventilators are in short supply, in part because it says so many are needed to equip the vast emergency Nightingale Hospital set up in Docklands in a matter of days.
We're running out of ICU-grade ventilators. More have been ordered, but Nightingale is holding a lot of stock destined for hospitals.
Tonight, the hospital said they're working to open equipment supply oxygen for extra intensive care capacity. In West London, an emergency mortuary has been set up. Vans to transport the bodies, generators for refrigeration, a heavy security presence. Recently, Public Health England said bodies aren't infectious, there's no need for body bags. It then contradicted itself, stating bodies can be infectious for up to 72 hours and those handling bodies should be aware that there is likely to be a continuing risk of infection from body fluids and tissues. Authorities in Northern Ireland have totally different guidance, again saying double zipped bags should be used because of infection. Obtaining zipped body bags is a problem. One leading supplier has told us stock for NHS trusts has run completely dry, leaving only pouch bags like this being divided up as fairly as they can.
Alex Thompson reporting. And in the last hour, Public Health England has told us that their guidance for the care of the deceased was produced in close consultation with experts and is aligned with advice from the Health and Safety Executive. Krish.
Well, joining me now is Mark Woolhouse, a Professor of Infectious Disease Epidemiology at the University of Edinburgh. Professor, it was made clear today that if we don't stay at home, the disease will spread and more people will die. Is that always going to be the case, as long as there isn't a vaccine or a cure?
No, it's not going to be as bad as it is now if, you quite rightly say, everyone obeys the regulations. But some things are not going to change in the foreseeable future. And two of those are the importance of people with symptoms self-isolating and the importance of households with people infected within them quarantining. That's going to be with us for a very long time, I think.
But doesn't that mean that at any point, whenever the decision is made to start relaxing the lockdown, that is a calculation that says we know there will be some more spread of the virus and therefore some more death?
That's exactly right. And that's what the epidemiological analysis and modelling will look at very carefully over the coming weeks and months. The hope is that we can relax some measures, probably not all, once the epidemic curve starts to come down. And what we're particularly looking for is every single indicator to come down, including the death rate, which will be the last one to do it, hopefully in a week or two.
So how will you explain to the public, when they are losing their loved ones, that this was a deliberate decision?
We're not talking about that. We're talking about relaxing the restrictions where they can be done safely. And there are two elements to that. First of all, which restrictions are actually not contributing much to transmission or transmission control, and we can relax them, but also which people we can move them from. And the point about the social distancing measures we have at the moment is they're very crude. They apply right across the whole population. But the public health burden of this virus is not across the whole population, at least not evenly, although everyone's at risk for it and everyone should be concerned. But it's particularly concentrated in a vulnerable group of people who are elderly and people with underlying conditions. And what we should be doing is concentrating on protecting that population, as you quite rightly say, to protect lives, but also to reduce the burden on the NHS.
So what proportion of the population do you envisage now getting the virus before there is a vaccine?
We're not making forecasts of that kind. What we're trying to do is balance the very severe costs of these lockdown restrictions, the economic costs, the social costs, and the costs psychologically as well, against the public health benefits. I mean, that sort of calculation is carried out for every single infectious disease. There's nothing special about this virus in that respect.
But there was a projection, wasn't there, of 80% of the population getting it? And that was regarded as very high because that would mean hundreds of thousands of people dying. Are you saying that that number is now lower than 80%?
Oh, yes, considerably lower and spread out over a longer time. But that's a very pessimistic view. As I just mentioned, if we are able to protect the portion of the population that is most vulnerable and protect them very well indeed, this will be hard to do, but there's a lot of technology available now that might help us, then we can actually bring that death rate right down.
So does that mean that that proportion of people who are vulnerable will effectively have to be shielded for a very long time?
Well, that's the key question, and how to make that acceptable to everyone concerned. But at the moment, the government advice is for those that are being shielded, they should shield themselves 12 weeks. It may be, it depends on the progress of the epidemic and lots of other considerations that you've mentioned, that will have to be extended, and perhaps extended significantly. But it's very important that we do concentrate the effort where the public health burden is greatest. And we know where that is. It's in places like hospitals and care homes, if you've been describing on your programme so far. Those places need protecting. The people within them need protecting, and the people who work in them need protecting.
There was a hard question asked today at the government press conference, and it was sort of battered away by the government scientists. And it was that, are people now dying because of mistakes in decisions made by the government and its scientific advisors in the delays to both the lockdown and testing?
As I said before, every single public health decision has to balance costs and benefits. Very hard to do in a rapidly evolving situation with a completely new virus. I'm sure there'll be lots of inquiries to find out if the government got it exactly right, but in my view, it's got it about right. It's reacted quickly when reaction was needed.